Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And as always, we are here on Facebook Live to take your questions directly about COVID-19. Today is Tuesday, August 31st, 2021, the end of August, believe it or not. And boy, have we been at this a long time. Thank you so much for joining. As always, you can put your questions directly into the box below, or you can use the hashtag AskDrArwady on either Facebook or Twitter. And the goal is really to get through a fair number of questions today. We don't have a special guest. We will again back on Thursday. So we'll start, as always, with our local Chicago data. So you can go to chi.gov/COVID- and let's pull that up and take a look. So overall, we're actually doing quite well, I would say, in Chicago. We are averaging 473 cases per day, which is basically flat from where we were a week ago. You see we were at 463 a week ago. That's up just 2%. That's 17.5 per 100,000 per day. So that's in the context, our travel order goes in place at 15 per 100,000. And the country as a whole is at 39 per 100,000 per day. So we are well under half of the average COVID rate for the whole country. And then what I'm pleased about is we're seeing some real flattening here. I think that is largely a result actually of putting the masks back on indoors. So thank you for everybody who's been complying with that. My hope is that as we get through this Delta surge, it's going to look more like what we saw in May when many people were vaccinated as compared to what we saw early on. Although certainly around the country, we are seeing a number of states that are having the worst outbreaks they've ever had. Hospitalizations, we're averaging about 22 a day. That's also looking good. We're averaging 2 to 3 deaths a day. Our vaccinations are up. We're at more than 4,500 again, which is good to see. And if you hover here, you can see early July we were only at about 3,800 a day. So this is up about 15%. Good to see. We're still testing really well here, almost 12,000 every day. And in that setting, our positivity remains good. It's at 4.4%. Again, pretty flat from last week when it was 4.5%. We've actually not yet gone over 5%. And that is a very good sign. It tells us we're testing well. Sometimes people ask questions, which is more important, the case rate or the positivity rate? We really look at both of them together, because when a place has a very high positivity rate, over 5%, you're not probably testing quite enough, or you're not detecting enough cases. When you're over 10% positivity, you're definitely not, and you're not considered in control if you have over a 10% positivity, regardless of what your case rate is. So the problem is that in a lot of those southern states right now, not only is the case rate really high, in some cases more than 100 cases per 100,000 per day, but also the positivities are like 20, even 30% in some of those counties. So overall, we continue to be in pretty good shape, even while a lot of the country is increasing all around us. So we've gotten a number of questions in from some of you about how to look at other data on here. And I just first want to remind you, along here on the dashboard, this gets updated every day. You can look and see either cumulative, or you can move this dash and see kind of what's been happening over what time period. You can do that for cases, you can do that for hospitalizations, you can do that for deaths. You can also look at any of these by age or gender or race, ethnicity. I encourage you to really explore. This is the same data we use when we're looking at this. You can also look at cases by zip code, again, percent positivity, or cases, or tests, or deaths. You can look at the most recent week. So I encourage you to really explore here. This is where our testing data is. So our percent positivity, for example, you can see is flattening out right now. This is where you can see vaccine data. So you can see citywide, we're at about 71% of people over the age of 12 have gotten at least a first dose, and 64% have completed. But you can also, if you want to see how that's changing over time, if you want to see what daily average doses look like, you can break any of this down by age, you can break it down by gender, you can break it down by race, ethnicity. So again, explore there. And then if you want to look by zip code, this again gets updated every week, and so you can see which are the zip codes that are improving the most. You can see by zip where you are. You can click on any zip code like this, hover over it, and it'll show you the details by age, doses per capita, et cetera. And for all of these, you can do this by 1 dose, completed vaccine series, total doses. You can also filter if you want all ages, or we often will look at the 12 plus, because that's the category that actually is eligible for a vaccine. So like, for example, when you look at the total number of doses for those over 12, down here in the Southwest actually has done the most doses for total doses for 12 plus. Whereas if we look at the one dose, you can slide here and see, like, for example, those are the zip codes that more than 80% of the population has had at least one dose. So I'm happy about those zip codes, but look at how most of that city is still not there. Denmark, by the way, just has passed more than 80% of its whole country over the age of 12 vaccinated, and they're planning to drop COVID restrictions. So as there are places that are quite a bit ahead of the US in terms of vaccination, they're offering us an opportunity to really learn and see, that really there's a way to kind of get past COVID, but it is primarily about vaccination. Okay, so in addition to some of the details that get updated on the dashboard every day, we got some questions like Brenna, wrong name. Courtney Connolly on Twitter said, show us today's hospital data for Chicago. Eric New on Twitter said, what percentage of currently hospitalized in Illinois are vaccinated? That's the important number. Where is this data? So I also wanted to just take a minute and show you where all of that data lives. So in addition to the dashboard down here, up at, on the main COVID pages, up at the top here, there's this latest data tab. And the first tab for that is the daily dashboard. But then all of these give you much more additional information. And so, for example, this coronavirus at a glance will show you what's happening over the entire pandemic for tests or positivity or cases. It also looks at what the race ethnicity has been and the age has been for deaths, cases, hospital capacity, everything is all in this at a glance. And so it's one easy place to see where we are in terms of capacity. So for example, right now we've got 114 people today in the ICU with COVID and 20% of ICU beds available. That's not the average, that's just today. We've got 249 people in non-ICU, 19% of our non-ICU beds available. These are very good availability numbers, by the way, for Chicago. They're just fine for this time of year. And then we've got 56 people on ventilators right now, and 70% of our ventilators available. You can also, if you want to look at vaccination data at a glance, there's a similar sort of overview of where we are. But then right here is where you can see some of the breakthrough data. So let's take a quick look at that. So here we have cases, hospitalizations, and deaths. So if we look at cases, this is all Chicago data, and you can see that as we've had this rise in cases, we certainly have seen case rates go up both among the unvaccinated, which is in red here, as well as among the vaccinated. But a big difference in terms of much higher case rates in those who are unvaccinated. So the blue would represent breakthrough cases. Hospitalizations is where this gets even more stark. And this is, with this graph here, still 99.9% of vaccinated Chicagoans have not been diagnosed with a breakthrough COVID infection. If we look at hospitalizations here, you see, again, this gets updated each week. This is where we really start to see a lot of difference, where unfortunately, the great majority of people who are being hospitalized with COVID at this point are in red here among the unvaccinated, whereas in blue, slight increase. This is especially among those over 60 who are having a breakthrough hospitalization. But this is really low. If you look at this, it's like 3 per 100,000 per week of vaccinated people getting hospitalized, and more like 15 for those who are unvaccinated. And then similarly, you can look at deaths, which is even more stark here, where we're having very few, much less than one person per 100,000 vaccinated Chicagoans dying of COVID. Again, largely people who are immunocompromised or quite a bit older, or both. And then in red is the rate of deaths among those who are unvaccinated. So this is where you can look and see updates there. I'm doing a press conference actually this afternoon at 1, and we're going to show a little bit more of the age breakdown here, but the high level is there. And then similarly, Courtney, if you want to see a little more about hospital capacity, you can click on hospital capacity, and this will show you sort of over time, what have the numbers been like over time. If you want to see acute non-ICU, you can really hover and track. This is anybody who's hospitalized in Chicago, in a Chicago hospital bed, regardless of whether they're a Chicago resident. So we both track Chicago residents who are getting hospitalized each day. That's the number on the main dashboard, as well as what our hospital capacity and numbers look like overall, because of course, Chicago is a main referral source. Many people who are seriously ill outside Chicago will get transferred into Chicago for the highest level of care in the state. So hospital capacity is how many people with COVID are in the hospital regardless of their residency. And then on the main dashboard, new hospitalizations per day, that's about 22, are how many Chicago residents are currently getting hospitalized. Okay, so that was a lot, and I won't go through the rest, but if you want to see what our reopening metrics look like, our doubling time, the data portal is where you're able to actually download this data and explore it yourself. That also gets updated every day. And then our archive data reports are where we put more historic things that we've published. So that's where you can find your answers. We can come off the dashboard. I am really, really proud of our dashboard. Slalom has been a great partner in terms of putting this together, and we keep taking feedback from you. So if you've got suggestions for other things you'd like to see. Oh, I'm sorry, I forgot to show the variants, and I meant to, because someone had also asked about variants. Can we go back up? Sorry. So on this variance breakdown, you can see, first of all, the national variant data. So this is you can look for the whole US or you can look for region 5. So in the whole US, the orange here, this B1.617.2, that is Delta. It's all Delta at this point, right? 98.8% of what is being detected in terms of variants is now the Delta variant. And really almost the remainder is this AY.2, AY.1 are different versions of Delta. So there's virtually nothing at this point. It's completely outcompeted all of the other variants. But you can hover and see how these have changed over time. You can also look by region, so you're able to look just at we're in region 5, which is Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And again, it's basically everything. 99.1% we're estimating at this point is Delta. And another 0.2% is the other part of Delta. But then also, if you want to look and see, what's happening in Illinois, this is a link to the IDPH data. Or if you want to see more about Chicago, you can look at any of our reports and, get more of a sense of, how, for example, there's more about how we do this, what have we seen in terms of variants of concern, what have numbers been look like. So this is where you can explore, and that gets updated. But the bottom line is that really, everything that we are seeing is the Delta variant. And that is what we expected because it is so much more contagious. Okay, now we can truly come off the dashboard, sorry. All right, so let's go ahead and get directly into some of your questions. Okay, good, lots of good questions. We've got Jen on Twitter asking, what's the data for people who have tested positive and CDPH is unable to get a hold of? Okay, good question. So let's kind of review this a second. Every single positive COVID test for any Chicago resident gets reported to the Chicago Department of Public Health, no matter where you get tested. So if you get tested at a laboratory, a doctor's office, anywhere, it all automatically gets reported. And when it is reported to CDPH, there is certain data that is associated with that report. We know the person's name, we know the person's date of birth, we know the person's address, we know the person's race, ethnicity. And we use that data to then our case investigators, contact tracers, continue to reach out to every single person diagnosed with COVID in Chicago. So the phone number that we call from is 312-742-6843. That's 312-742-6843. But it shows up as Chi Tracer Core with most of the cell phones, and because we know people may not answer the phone from an unknown number, so we've worked to have that actually show up as Chi Tracer Core so that people know it's related to COVID tracing. But the point is, if CDPH is unable to get a hold of somebody, we still count them in the data because, again, we know their age, we know their address, we know their race, ethnicity, and of course we protect identity, and you can't look up the individual address of somebody, but you can see what zip code they live in. You can see how age and race, ethnicity, and patterns kind of play through. And then we do the same thing for anybody who's hospitalized or anybody who's died. Anybody who's hospitalized or died from COVID, there's an extra level of investigation that happens there so that we can understand it. And all of that shows up on our dashboard. Good question. Okay, we've got Jenna via email saying, a coworker just tested positive. Should I get tested? I am fully vaccinated. Okay, good question, Jenna. So first of all, I would like to refer people to chicago.gov/COVID test. Chicago.gov/COVID test has all kinds of information on it about testing. If you've got questions about when to get tested, what kind of tests to get tested with, you can put them in here, but also many of these questions are answered on that website. So let's talk about this situation. It sounds like you're at work and somebody at your workplace has tested positive. Because you are fully vaccinated, you do not automatically need to quarantine just because you've had a coworker or a close contact test positive. That's one of the really important reasons to get vaccinated. It is not completely out of the question, of course, that you can contract COVID. We have seen, we're seeing some breakthrough cases. That's why we're doing the full masking indoors, because we are at increased risk right now, even if people are vaccinated. The risk is much higher for those who are unvaccinated, but clearly that risk is there even for those who are vaccinated, because unfortunately there's no such thing as 100% protective vaccine. But boy, this vaccine, especially for severe illness and death, is performing well. So the number one question is this a coworker who you actually had close contact with? We use the same definition of close contact, within 6 feet for 15 minutes or more cumulative. When you're diagnosed with COVID, the CDPH case investigator calls, talks to you, the contact tracers reach out. All of that happens without you needing to do anything. But the bottom line is that if you were not in close contact, there's nothing that you should do except monitor yourself for symptoms. And just a reminder to everybody right now, vaccinated, unvaccinated, if you've got symptoms that could be consistent with COVID, even if you just think it's a summer cold, you're just not feeling well, please take a COVID test because we are seeing more breakthrough. If you are diagnosed with COVID and you are vaccinated, that wasn't your exact question, but we've gotten variations on this. You still need to treat it like a regular COVID case. So you still would need, if you get diagnosed with COVID, even if you're vaccinated, you need to isolate for at least 10 days, okay? So you would need to stay home, but the difference is the people around you, if they're unvaccinated, they need to quarantine at home for the whole time, but then people who are vaccinated don't need to quarantine. We do recommend, though, that anybody who's been in close contact, even if they're vaccinated, do get a test 3 to 5 days after. And again, our case investigators and contact tracers, when they're calling, help talk people through those recommendations. All right, Carol Aguilera Lugo is asking, can I get the flu shot and the booster shot when it's approved in the same week, or should I wait a while in between? Yeah, really good question, Carol. You can get them at the same time. So this is one of the things that, as there's been additional information and research, right at the beginning, they really wanted to separate the COVID vaccine from any other vaccines, just to make sure we weren't seeing, unexpected side effects or any interactions. But for months now, actually, it has been the recommendation that you absolutely can get the COVID vaccine at the same time as any other shots. And that's especially important for children. Obviously, Chicago Public Schools just gone back to school yesterday. We're doing a lot of work to catch kids up on vaccines, and those adolescents who are 12 plus, we definitely want them to get that COVID shot at the same time, for example, as they would get their shot for meningitis or tetanus or HPV or any of those other adolescent vaccinations. But yes, when the booster shot is approved, I encourage you actually to get them together. Obviously, you don't have to, but that's one fewer trip to the pharmacy or to the station. And we are planning actually to do a fair bit. My guess is that a lot of the booster campaign, once it's approved, is likely to overlap with our flu shot season. So it'll really be up to you. You're welcome to separate them or get them at the same time. Didi Ruiz on Facebook saying, good morning. Do you recommend getting the flu shot if you are fully vaccinated? And do you recommend flu shots for kids? Thank you, Didi. So I absolutely recommend getting the flu shot if you're fully vaccinated. And that's because fully vaccinated for COVID protects you against COVID, but it doesn't do anything to protect you against influenza. They're completely different viruses. And influenza mutates so quickly, and there are so many many different strains of influenza that every single year scientists actually look to see what are the most common strains of influenza, and they make a new flu vaccine that protects best against those strains of flu. And so we absolutely recommend really virtually everybody over the age of 6 months should get a flu shot every year. I get a flu shot every year. It's a requirement for people working in most healthcare settings. And so even if you are fully vaccinated against COVID, you 100% should get that flu shot when it becomes available in the fall. And do I recommend flu shots for kids? Absolutely. And in fact, you know, if I have for the young children in particular, I am honestly more worried about influenza in some ways than I am COVID, because the very youngest kids, when we look at influenza, meaning those especially under 5, actually have much higher rates of severe illness, hospitalization, even death from flu, just like we see for older people in COVID. So in COVID, we've generally seen quite rare serious infections, thank goodness, in young children, but we see high risks of severe illness, hospitalization, and death with older people. It's more of a U-shaped curve for influenza and actually for a lot of other viruses too. And so for kids in particular, we want everybody to get a flu shot for sure. We're also heading in, but for younger, you know, for children and for those who are older, it's especially important. And the other thing is, as we're heading into the fall and winter here, you know, I am a little worried about what may come from a COVID perspective. We're not as vaccinated as we should be against COVID, and we are absolutely seeing cases of hospital systems getting overwhelmed. These are true that you're seeing in some other parts of the country. It is not true right now here in Chicago. Downstate, they are starting to really feel that, where they're seeing some much worse surges of COVID because they're less vaccinated. But Florida, Oregon, there are multiple states that are really having problems. Texas with hospital capacity, and my worry is that where you think about where people spend time indoors and outdoors, in the South, in the summer, people are indoors a lot because it's so hot and you're air conditioned, and they more move outdoors in the summer. We're the opposite here, right? We're more outdoors in the summer and then move indoors as the weather gets cold. And so there's some, we don't know this for sure, but there's some concern that could we see some more increase like we do for the other viruses as we move more into colder weather. And one other reason to get the flu vaccine is we don't want you hospitalized with flu. We want to keep those beds available for people who are getting infected, not just with COVID, but with RSV and, you know, all kinds of other diseases. Joanne Dovidoskis Doria is asking, are the boosters the same brand as the vaccine, and would there be side effects if taken with a flu shot? All right, more good questions, Joanne. So again, no booster recommended yet, except for people who are immunocompromised, but we anticipate that guidance coming. And yes, I anticipate that the recommendation would be for you to get a booster with the same vaccine that you got. And at this point, they're still looking, particularly that J&J data. You may have seen that there were some new data suggesting that a second dose of J&J helps potentially boost some immunity in the same way that a third dose of the Moderna and or the Pfizer vaccines do. But right now, no recommendation for boosters except for people who are immunocompromised. We're anticipating it'll be something coming, you know, probably quite soon, and we will certainly update you about that. But yes, the expectation is you would take the same brand as what you had gotten previously, and that you would take that booster probably, likely it looks like 8 months-ish after you'd gotten your second dose of vaccine, so like 9 months, give or take, after the first dose. And would there be side effects if taken with a flu shot? So, you know, I can't answer that for an individual person. We have seen more side effects generally with the COVID vaccine than we have with the flu vaccine. But people can have side effects with either. So for example, when I get a flu shot every year, and there are some years I have almost no side effects, and there are some years I really get a sore arm. I don't really get much beyond a sore arm, and I actually had more of a sore arm from a flu shot than I did from a COVID shot, but that just happens to be my response to it. And I think, there's certainly, as we're looking at the flu and the COVID vaccines being given together, we can better answer that. But in the studies that have been done, looking at people who have gotten these shots at the same time, they've not seen major problems, certainly, or serious side effects. I'd say if you're really worried about side effects, or you're someone who gets bad side effects and you wanted to separate them, you certainly could. If you're someone who just gets a sore arm, like I would feel comfortable myself getting my flu shot and my COVID booster if it's recommended at the same time. But I don't think it makes too much of a difference. But I'd say if you're worried about it, you could separate it out. Okay. All right. So Kingsley Zizou on Twitter is saying, can you post a single scientific study that proves cloth masks do anything to mitigate COVID? There have been a lot of scientific studies about this. So what I'll do is we'll post in the comments, we'll post the link on the CDC website where they actually catalog this. There's about 60 studies that are actual scientific studies looking at why masking is important, why it's been proven to be helpful. Masking is not the whole story here. Just like we say vaccines are not 100% effective, masks are also not 100% effective. However, they certainly have been proven to mitigate or decrease that risk. And I really, personally, I look no further than Florida, which actually has a pretty good vaccination rate. It's not like some of the other southern states that are lagging a lot in vaccination. They're 50% plus vaccinated, and yet are having the worst surge they've ever had. And part of that, scientists believe, is because they really have that's one of the states that has said no masking. Like, not only are we not going to require it, we're actually going to say you can't have masks on, even in settings where people are unvaccinated. And so, as opposed to getting into it, we'll post that link, and then I would encourage anybody who's got questions about any of those studies, please take a look at them and then raise them. Like, I want to help people understand this, and we really think about not just for COVID, but protecting against any disease. There's a few things, you've heard me talk about this, that we look at. We look at the host, meaning us, the humans, what changes there. The big thing is we get vaccinated or we don't get vaccinated, but it's also our behavior, things like do we mask. We look at the virus itself and how it changes. That's especially things like variants becoming more contagious. And then we look at the environment. And the environment is about the sorts of things that we do really at a population level. So things about, like, if we're masking more universally, if we're improving air filtration, if we're outside more than we're inside. All three of those work together to kind of change risk for COVID. And so we're getting some questions in about when did the mask come off? What do we look like? So as a reminder, when we're over 400 cases per day here in Chicago, that's corrected for our population. That puts us at high risk for community transmission, as defined by CDC, and actually as CDPH has defined all along from the beginning. It has to do with what is the chance that as you're out and about in Chicago in public settings, especially indoors, you're likely to potentially come in contact, that there's going to be somebody who has COVID, whether or not they know it. So that's not an arbitrary number. It actually is based on the risk of that. And while we're over that rate here in Chicago, I believe very strongly that having everybody put the masks on, not forever, but while we get through this Delta surge, is one of the things that helps keep the risk down for everybody, helps protect those hospitals, and most importantly, helps us stay open, which really is the goal. So the state has now also put a mask mandate in place. So those would both be in place, even if we dipped under 400 again, we would also, the state would still apply until that's getting better. But bottom line is right now we're flattening. If we can stay flat, I'd be very happy, given what's going on around us. We'll have a sense, hopefully, over the next few weeks of whether this is a true sort of flattening and we're going to see some decrease, or whether we may still see some increase. But regardless, the masks are staying on for everybody right now. And, with the increase in some of these breakthroughs, especially before boosters are fully and widely available, just, that mask, it really helps protect everybody. If given a choice between a vaccine and a mask, yes, take a vaccine. But we talk about Swiss cheese. There being various ways of kind of stopping your risk of COVID. Vaccine, if the virus is trying to get through you, through a piece of Swiss cheese, it can get through, right? If you're not vaccinated, if you're not masked, if you're not outside, putting all of these together in different combinations limits your risk. And so when our risk goes back down, we will be dropping those indoor mask mandates. But while it's up, it's to help protect everybody. Okay, Michael Lopez on Facebook. Will I be able to receive the booster shot as a member of Group 1A if the FDA approves booster shots? I received my second dose of the Pfizer vaccine January 2021 as part of Group 1A. However, I no longer work in healthcare. I now work in K through 12 and higher education as a teacher instructor. Okay, another good question, Michael. So for those who may not remember, when the first vaccines were available, we had this 1A category that was healthcare workers. We had the 1B category that was high-risk employees working in high-risk public-facing settings that included educators, and then we had 1C that was everybody who was a little older, and then we had everybody. And so I expect, again, we're going to have to wait for the FDA and the CDC to make that full recommendation around the booster shots. But I don't expect us to be doing that same 1A, 1B, 1C. My full expectation is that the recommendation will be a certain amount of time after after your initial vaccination series would be when the booster was recommended. So even if you were in Group 1A and you were a healthcare worker the first time around and now you're not, you would, I expect, still be eligible for a booster, 8 to 9 months, whatever the decision is, after your initial vaccine, regardless of what your job is now. And that's because we have enough vaccine now, compared to earlier where we were so limited in our ability to make vaccine. And there was such a demand for it, and they were really trying to ramp it up quickly. And we didn't have 3 vaccines available. We now have three vaccines available, and obviously some also have that full FDA approval. Some of that comes from actually having done all the checking of the capacity and the ability that we can now produce this much more quickly. And so there isn't going to be, my expectation, the same difficulty with accessing boosters as we saw early on. Most people in Chicago are getting vaccinated right now at pharmacies, and I actually expect that's likely to continue probably for boosters. So yes, I expect, regardless of what group you were in, you would be able to get that booster shot pretty much on time. And we're doing a lot of planning to be ready for that whenever the recommendation does come. Okay. Janice Brown on Facebook. I reside in Chicago, however, was COVID vax in Indiana. How can I get my information shared to Illinois so I'm counted toward the state numbers and so I can enter my info for VaxPass in Illinois? All right, great question, Janice. So we are working behind the scenes. This is really a state level thing, not a city level thing, but we've been working with Indiana especially to exchange information and have some understanding of what those numbers have looked like. So we actually know, how many Chicagoans, for example, the city does, how many Chicagoans were vaccinated there. We know the zip codes, we know the ages, and we've been able to use that to adjust where needed, where we know that's not coming through. But at an individual level, for Janice Brown's record to be there, the state of Illinois, IDPH, is working with Indiana and actually all the other states to have more of the state registries connect to each other. Because this is good not just for COVID, but for other vaccinations. People move around the country. So I would encourage you, first of all, you can always email COVID-19 vaccine at cityofchicago.org, and we can help sort out your individual problem. But also, if you have a record of that vaccine, you're able to upload that, you're able to get that into the system. And I know that the state is working hard on being able to better combine at the individual level some of that data. So thank you for getting vaccinated. Again, that reminds me of the time when it was so, it was really hard to get a vaccine, and Gary, Indiana in particular was really lovely and opened up their large facility to anybody because they had vaccine that was not being used. And we saw quite a number of Chicagoans, especially from the far south side, go and get vaccinated there. So there is not a VaxPass formally in Illinois, is just the other reminder. So as long as you've got your CDC card, that's what you need, okay? There's not an electronic version that you need. If you've got your card, you can show your card, you can show a picture of your card. So don't worry that difference is going to somehow make you not able to access things, okay? All right. Courtney Ritzema on Facebook says, can you talk more about how you think schools being reopened will affect the ICU availability? Okay, so Obviously, we watch the hospital and ICU availability very closely here in Chicago. Really, our overarching goal throughout all of COVID has been, in a lot of ways, to protect the healthcare system. When we see the healthcare system get overwhelmed with patients, that has completely unsustainable effects on others. And we are seeing people in, on Facebook myself, I'm friends with a lot of doctors, obviously. I've got doctor friends from residency, et cetera, who work around the country, and they're posting about people, somebody posted about a man who actually died of a gallbladder infection because he couldn't get admitted to the hospital where there was surgery available soon enough and they were trying to transfer because the hospitals are so full. And when we see hospitals really at bursting capacity, we really start to see these effects, not just from COVID, but people with heart attacks and after accidents and other people who need hospital resources unable to access that. So that is completely unacceptable. And for me, anything that seriously threatened healthcare capacity would be a major drawback. That said, our child numbers right now look really good in Chicago. Our ICU availability looks fine, even for pediatrics. We've been staying in good touch with all of our tertiary hospitals, with Lurie and Comer at U of C, Rush, anybody who admits kids or especially has ICU capacity. And they absolutely have pediatric ICU capacity now. As schools are open, I think we probably will see some more COVID cases. I don't expect to see a large number of COVID hospitalizations, or especially ICU hospitalizations among children, but keeping the risk down for everybody, right, is important. And I think one of the challenges is because Chicago is such a center for the whole Midwest for the highest level of care, we will sometimes see patients, regardless of what their disease is, transferred in from downstate Illinois or from Indiana or from Wisconsin who need especially ICU level care. And so we are likely to see some more, I think, higher numbers, but I'm not worried, and neither are our pediatric hospitals right now, about anything that would overwhelm that capacity. We're actually seeing a lot of kids right now getting admitted, young kids getting admitted with RSV, which is a common viral infection among children and can be really pretty dangerous among young babies in particular. And part of this is as kids, as everybody, we've been more open and moving around. It's not just COVID. Actually, we're seeing some of these other childhood viruses really circulating again. One of the things with masks is that we went almost a whole year here with very low rates of other childhood viruses, right? Low rates of RSV, way down in terms of asthma attacks, which are often triggered by viruses, way down in terms of ear infections. Other things that often can be linked to childhood viruses have all been down. And as kids, especially young kids who maybe were not previously exposed, are back in daycare, are back in school, I think we'll see more of those actual childhood viruses. And again, for kids who are in school, for their families, you've got a symptom, you need to get tested, please. And get those, if you have the ability, I would get a 2-pack of those at-home COVID tests. They're about $24. You can get them at Walmart, you can get them at Walgreens, you can get them at CVS, you can get them at Target, you can get them online. I ordered mine through DoorDash even, I think through CVS. And you get a 2-pack, and you can use that for kids, you can use that for adults. It's a very quick self-antigen test that within 15 minutes can really, give you some peace of mind there. Obviously, if it's a high-risk setting or you've got more concern, you should go to the doctor, you can get a PCR, but I very much encourage people to do those at-home antigen tests, because if your at-home antigen test is negative, the chance of you spreading COVID is virtually nothing. Okay. Jen Fleur on Facebook. Since I was double masking pre-vaccination, should I be doing the same now? So Jen, I don't know your status or why you were double masking. If you are immunocompromised, for example, and you're highly concerned about that, double masking certainly helps. We also see some people making the choice to wear more of a KN95, for example, at this point, that can do more to protect yourself. But the most important thing though is that that wearing a mask that you actually will wear. The KN95s, you know, they provide more of a seal around your face, and so they can be good if you're highly concerned, especially if you're immunocompromised. But they are tighter and they are less comfortable. And again, if everybody in the indoor setting is wearing the regular surgical or cloth face mask, people are really keeping their germs to themselves for the most part, and that helps protect folks. So not knowing your whole situation, I would say, you know, if you were double masking and that wasn't causing you significant concern, please go ahead, double mask, wear your KN95, whatever you're comfortable with. But really everybody having the mask on in the indoor setting is probably the more important thing at this time now. And then I'm presuming that you're vaccinated. Obviously, getting vaccinated is more important than you know, if you were going to choose between a vaccine and a mask, choose a vaccine. But then right now, while this surge is on, we need a mask as well. Dylan Potter on Facebook says, on the portal, you have 8 different variants labeled. When did these other variants happen? Oh, I love this question, Dylan. So there have been probably hundreds of variants that have actually occurred. And the way this works is, all over the world, whenever a COVID virus gets its DNA, gets its fingerprint taken, basically, where we look at what is the sequence of that COVID virus, those all get uploaded. There's a big system where those are all shared with scientists around the world. And every time that we see a mutation, because COVID, like every other virus, mutates, it continues to evolve. If there is a mutation that is more, that in some way seems to make the variant outcompete the others, it gets labeled a variant of interest. So if you start to see, you know, most variants don't matter at all, like they don't change anything. We call it a variant of interest if you start to see more sequences that match, because this says, oh, maybe there's something about this variant that is of interest. You know, could it be more contagious? Could it be making people sicker? Could it be evading treatments, et cetera? If then we actually see a variant of interest truly being shown to do one of those things, be more contagious, it then gets labeled a variant of concern. And variants of concern include the alpha, the Delta, you know, there have been a few of them. And the Delta right now, obviously, is the variant of concern that has outcompeted virtually everything else. But I expect that we will continue to see these mutations. We continue to follow them. There actually is one more level above a variant of concern. If we were to ever have a variant of high consequence, we've never had one of those yet, that would be an example of something that would really, unfortunately, change the game for COVID, I think. If, like, the vaccines were no longer protective against it, or it was making people so much more severely ill, or, you know, anything different, that would be considered a variant of high consequence. We've never had a variant of high consequence, but we've had a number of variant of concerns and lots of variants of interest and like hundreds of other variants. And so, yeah, I encourage you to explore there if you want to see some more about that. CDC has more information, but yeah, we continue to monitor all kinds of variants, but where you see a variant outcompeting, that's one we're worried about. And I expect we're going to keep hearing about new variants. Okay, we are at time. As a reminder, we have a press conference today in just an hour or so at 1 p.m. We'll be providing some COVID updates. We'll also be providing, the health department's been doing a lot of work on improving access to mental health, particularly in the time of COVID. Folks have obviously been heavily impacted, and we're going to share some exciting new information about that. I'll probably have someone from our mental health team on again in the next week or two to talk some more about that. We will be back on Thursday. We're going to have a special guest on then as well, but more opportunity to take your questions. So thanks, everybody. Really good questions today. Please continue to send them in. If we didn't get to them, we'll try to get to them on Thursday. But always check out our website, chi.gov/COVID- for data, chi.gov/COVID-vax for anything about vaccines, and chicago.gov/coronavirus for the OG, the original coronavirus information. Thanks, and we will see you on Thursday. Be well.